On Saturday, the 31st of October, the UK Prime Minister, Mr Boris Johnson, addressed the nation on new measures to take effect in England as the UK passed 1 million COVID-19 cases amidst what has been termed as a second wave of infection.
From Thursday until the start of December, you must stay at home. You may only leave home for specific reasons, including for education, for work, let's say if you cannot work from home, for exercise and recreation outdoors with your household or on your own, to shop for food and essentials, and to provide care for vulnerable people or as a volunteer.
The second national lockdown in England that began on the 5th of November outlined new measures aiming to reduce the rising infection rate seen across the country. These measures mandated that dine-in restaurants, retail stores, leisure and hospitality centres close their services. Members of the public may not mix households unless included within their bubble, but schools and colleges remain open during this term. The Prime Minister announced that the national lockdown measures will remain until the 2nd of December, with a view to returning to a regionalised tier system using the government's NHS Test and Trace scheme. In line with government guidelines, the Ahmadiyya Muslim Community UK have closed places of worship until the 2nd of December, to help minimise the spread of the virus during a time of increased risk of infection. Letters and messages were sent to members of the community, highlighting the government guidance and promoting the safeguarding of vulnerable people. The Ahmadiyya Muslim community continues to provide support to the vulnerable in society, with food banks, essential donations to NHS hospitals and charities, and support to efforts by the local councils and government to help society face challenging times. On the 2nd of November, the UK Prime Minister outlined measures from the government to support those made vulnerable by the national lockdown, with the continuation of the furlough scheme, increased economic support to the self-employed, and a medical report by the Chief Medical Officer for England, Professor Chris Whitty, outlining the efforts being made towards prevention and treatment of the virus on a national and global scale.
And the scientific effort that is going on at the moment is absolutely unparalleled. From the UK, with enormous work done through the National Institute for Health Research and Medical Research Councils and Wellcome Trust and others, and the academic sector leading that work, it is steadily going to come on top of this infection, just as it has every infection we've had to date.
Whilst the medical research continues its efforts, the Ahmadiyya Muslim Community UK remains committed to providing humanitarian support in solidarity with the people of its country. This report is brought to you from MT International, UK Studios in London.